and I, really what we want to do is just go over the course, give you a bit more information about it, a little bit about ourselves, a little bit about what you guys would get from the course, and hopefully the type of things that you'd be covering. So probably important to say it's an interesting time for us currently as FGDP and soon to be the College of General Dentistry. At the end of this month, as I'm sure you'll be aware, the FGDP kind of completes its transition from where it was sitting within a faculty of the College of Surgeons to becoming an independent College of General Dentistry. And our restorative course has been going for about 15 years within FGDP. And so this is a continuation of that course, just to take it into the new era that will be with the College of General Dentistry. So a little bit about ourselves. Phil, if we could click on the slide. So my name is Nick Lewis. So I've been involved for about the last 12 years with the diploma programme as it was. I started as a tutor initially. My own background is I work predominantly in the NHS as a restorative consultant. I was initially at the Eastman and now work in the Royal Surrey in Guildford. And I also have a private general practice along with my work as a general practice. My involvement as a tutor has been pretty much all the way through that 12 years, and I took over as one of the course directors about 5 years ago. And so I split my time between hospital practice and private practice, and obviously time within this course as well. The one person on this screen who's not here is Mike Mulcahy, who was one of the original course directors and was also previously a past dean of FGDP. So he's been involved very much from conception of the course and still continues to assist us as chair of the management board, as well as with marking assignments and things like that. Phil, do you want to say a few words about yourself?
Yes. Hi, everyone. My name is Phil Dawson, and I'm a little bit of poacher turned gamekeeper, because I did this course when it was in its first iteration, when it was diploma only. I did that about 15 years ago, possibly, and I'll safely say it just about transformed my practice and my practice of dentistry. I, by and large, still do 3 days a week clinical work, predominantly privately. I am an educational supervisor. I'm also the Associate Dean for Conduct and Performance. I examine for the ORE, and I'm in the middle. I feel the pain of the current students, because I'm in the middle of completing my MA dissertation for postgraduate education, because education is something I'm very interested in. I'll probably elaborate on it later, but it's not insignificant to say that this course, when I did it, it transformed my my outlook and practice of dentistry, and it was quite a sea change at the time when it started. It was probably the only one around. Now, obviously, as you probably know, there are other, you could say, competitors, but there are a lot of good quality courses out there. But that we believe, Nick, Mike, and myself, we believe that this is the strongest. It may not be the sexiest, it may not be the most flash, but we believe it's the strongest educational as well as evidence-based. Nick, are you okay if I just continue on then? Yeah,
no, you carry on. I'll take over at the other end, Phil.
Yeah, okay. So guys, the idea tonight is just to give you a flavour, an overall of what both the certificate and the diploma and how they work. We're not going to go into a huge amount of detail. Please feel free to ask questions either in the chat, or you can flick your microphone on. But you'll see this, the acronym CRD and DRD. The CRD stands for Certificate in Restorative Dentistry, and the DRD is the diploma. Both, by and large, work the same. The combination of the two is delivered by structured days. It tends to be a Saturday. Sometimes it's a Friday. If we have 2 consecutive days, it's all day Friday and all day Saturday. But the normal study days are held on the Saturday, and they're preceded on a Friday evening by a tutorial. It's by and large a mixture of didactic and hands-on. We do a little bit of blended learning. We have educationally a very, very sound presentation. We have small group, we have one-to-one, we have seminars. It covers all bases from the educational point of view. So whichever form of education suits you for learning, we should be able to deliver on that. We have a series of tutorials and very good tutor support. Almost without exception, the tutor support is one of the big pluses we get from feedback from current and previous students. I won't say where the tutors are available 24/7, but they are all around, and a lot of them have done the course, so they know exactly what the students, what the candidates are going through. We have master level assignments that we ask you to complete, and they allow assessment, but having been through it, not only do they allow assessment, but a massive learning tool. You will learn so much from writing the assignments. It's an amazing, amazingly powerful educational tool. And it will hopefully allow you the articulated path on to complete an MSc. We have the first year certificate, which after its successful completion, you will be awarded a postgraduate certificate. The award of that is only on completion of all parts of the certificate. There is no exam for the certificate. The diploma is you have to have the certificate, and then that's a 1-year program, which we'll elaborate on later. And then following an exam of presentation of 2 exam cases, that the successful candidates are awarded a diploma. Then hopefully we will have encouraged you to further your studies and your education by taking it on to an affiliated university, of which we've got 2 or 3 at the moment, Peninsula, King's, and Kent, and complete an MSc in clinical dentistry. We, as Nick said, and this is how I did it, we used to run a 2-year diploma course. There was no such thing as a certificate. And that started about 15 years ago, started up in Manchester, where I am. And then it quickly had a dual base, Manchester and London. And we used to run it, we used to cover all aspects of restorative dentistry. As you can see there, the occlusion, perio, prosthodontics, endodontics, operative dentistry, and then the SI's, special interest units. And we used to be able to choose between either periodontic or endo. And by and large, they were surgical days. They were exceedingly well received. We decided, only 2 years ago, that we needed to alter this approach to just a diploma into a separate certificate and diploma years. So we looked at, and we appreciated that there needed to be more flexibility. The guys coming in were getting younger and younger. When I did mine, I was probably one of the youngest, and I'd probably been qualified 10 years, 15 years almost. Whereas now, fortunately, and I think it's great for the profession, people seem to be a lot more dynamic in their learning, and they do realise it is lifelong learning, and they come out to foundation dentistry maybe a year or 2, and then boom, they want to progress their careers and their education, which is fantastic. The progression from the CRD to DRD also allows we set the first year in the certificates to be mainly the academic side of things, and then we elaborate and develop that academic knowledge that you'd have been given in the certificate year, in the diploma year, by introducing almost a lot more hands-on and face-to-face teaching. So it works now. The first year was about 7.5 days. We have a day and a half of induction, where really we set the scene. We help you to understand what we're going to expect of you. We give you a tip or 2 as to how to approach the assignments and all the individual elements. We also have a great session by Avi Banerjee, professor down at Guy's, who talks about minimally invasive dentistry, which is something that is a strong thread throughout all our teaching. We have 2 days of occlusion. One of those days will be hands-on. We have 2 days of perio, which usually are done consecutively, and they at the moment done by in my opinion, the fantastic Ian Dunn, who I'm sure many of you, if not all of you, have heard of. We have 1 day on operative dentistry, and we have a day on endo. These are theoretical days where we have some sort of quite didactic teaching, and our worry was it was going to be quite dry, but having gone through and listened to the feedback, it's fantastic. It really is. It's still dynamic, even though this year it wasn't face-to-face, it was done remotely. We have, throughout the first year, we have ongoing assessments, which will help to support the teaching days. We expect evidence-based assignments and 10 mini cases presented, which I'll talk to you about and elaborate in a little detail, and only 2 learning cases. And I'll show you what the difference between a mini case and a learning case is. But all of these, people tend to look at them and think they're hurdles that you have to cross, but they're not. They're actually an amazing way of learning and educating yourself. We expect our successful graduates, our successful students, to have developed their conservative management and a minimally invasive approach. So very, very modern. We don't prescribe that you have to do composite, for instance, over and above porcelain. But what we want you to develop is that idea that you can actually decide when is most appropriate and what's the most appropriate material to use. We want to develop this reflection. So you then develop yourselves a very strong basis for your own reflective clinical practice and understand that what you're using, why you're using it, and what is the evidence for its use. The hands-on skill helps you to enhance your own clinical dentistry and develop new techniques. And once you've completed successfully the diploma, you're 2/3 of the way to an MSc. And I have to say, having been through it myself, it is by far and away the most difficult part of the 2/3. The actual 3rd year, when you're with one of the affiliated unis, you're doing a dissertation, you're doing a research project, or systematic review, something like that, and it's relatively straightforward then to convert the diploma into an MSc, which, as we all know, is a relatively powerful set of letters after your name. That again, the overview. The diploma itself, we have it's over 1 year. We have 6 individual units. Each unit has 2 days. So that's 12 days in total. However, you guys only have to attend 4 units or 8 days. You can choose. You have the ability to upfront decide that whether you're going to do direct aesthetics, for instance, where we, by and large, that tends to be smile design and anterior composite work, be it doll build-ups. The modern way we like to try it now, it's all direct aesthetics. Okay, the 2 days of advanced perio, again run by Ian and a colleague. We look at periodontal surgery, be it crown lengthening, be it gingival grafting or flaps. Again, an excellent set of days. Endo, again, is a surgical element to it, whereas it's apical microsurgery, post removal, that sort of thing. Removable prosthodontics, restoring implants is something new. We've developed, obviously, with the continuing surge of implants. We're not talking about placing implants, obviously, but by and large, I'm sure you've already found yourselves, you will have patients coming with fractured restorations that are on implants, and we would like to be able to give you the tools to restore those implants. And then we have a 2-day on indirect prosthodontics, so bridge work. I ask you to nominate 4 of those 6, which is covered in your fee, but you were also allowed and encouraged to attend the other 2 units. So you can get, it's high quality free CPD. So if you took the first 4 of those, from direct down to removable pros, you could also attend the restoring implants and fixed indirect as a freebie if you want. You will be assessed on the 4 that you have put yourself down for, signed up for, but you're free to attend the other 2 units. And in the 2nd year, that we have a similar sort of assessments. There were 4 assignments, and we have further 10 mini cases and 4 learning cases. And then finally, if you do go through to the exam, there'll be 2 cases for the exam as well. The tutorials, as I mentioned, happen on the Friday evening, 2.5 hours there or thereabouts. They're again a highly powerful way of relating with your colleagues and just discussing it. We tend to have an experienced tutor who has had experience of the course. And we try and avoid the idea of what's called the sage on the stage, where the tutor sort of speaks and all the tutees listen. The best tutorials I run and am involved with, I don't say a word, and all the tutees are just chatting amongst themselves, and they're bouncing ideas off each other, and they're all coming with their own thoughts and ideas about a particular case. We expect you to bring a case or something to discuss, and ideally it's a great way of discussing your cases. So in the certificate year, the 2 learning cases. The diploma year, there's 4 learning cases. They're what you bring to the tutorials. You've got the tutor's input, but more importantly, you've got your fellow tutees to discuss it. And we're undergoing that at the minute. And it's a very, very powerful and interesting and enjoyable way of discussing. And there is a social side to it as well. Obviously, you're meeting self-minded colleagues who really are quite well motivated, like yourself. And it's a powerful way of progressing your understanding of dentistry, I have to say. So the actual tutorials, as I say, we've got through the CRD and DRD years, we've got a mixture of the didactic sessions where you will get lectures. We've got the small group tutorials, work-based learning. This is where you're doing your cases. So 2 in the certificate year and 4 in the diploma year. We have group treatment planning over the whole 2 years, especially on the Friday evenings on your tutorials. But we're not going to spoon feed you like undergraduates. It's self-directed learning, and you're going to be bouncing ideas off your colleagues. It will give you extensive clinical support to enhance your skills, and we expect those technical skills to increase. And your treatment planning skills will go off the chart, I promise you. Not only what you are treatment planning, but how well you are treatment planning it. And again, your academic knowledge will go off the scale. We try and encourage you to become reflective practitioners, okay, and develop a really strong current evidence base for your whole practice of restorative dentistry. So the assessment, the assignments, we expect, well, 5 in the certificate year and 4 in the diploma year, so that's 9 assignments in total. You get 1 at each unit. In total, 20 mini cases, 10 in certificate year, 10 in diploma year, and then you'll have to submit 8 cases. So in the certificate year, there's 2, in the diploma year, there's 4, and then 2 exam cases. I'll just mention it later, but you will find that they're all at different levels. You'll be very informally assessed and guided at tutorials. And for your final assessment, you'd expect it to be completed all study days. If you missed a particular study day, we try and help you the following year to attend one of the other study days. All of your tutorials and all of your assignments passed. 8 completed cases, fully written up, and they examined on the 2 cases. The assignments themselves, we're looking at master's level. Don't get frightened, we will help you. It's not undergraduate level, it's level 7, which is a master's level. So we're looking at your evidence base, we're looking at you being able to research it, and we're looking at your opinion. You're not just going to regurgitate, you're going to assimilate, and you're going to look at the evidence. For instance, there's a lot of assignments, but they're all, as you'll see from this example here, they're all very, very clinical. There's a lot of theory behind it, but it's all clinically related. So defining working length, relating it to local anatomy, that is the theory of it. You might not think it's particularly relevant to you guys on the Monday morning, but we then we'll follow that up with a practical side. What's your protocol for preparing to this length? What consequences might there be if you're over or under? And where do you get this knowledge? Where's the evidence base? Okay, and how is that going to affect your patient? What are you going to tell the patient if you're 2 millimeters through or you're 2 millimeters short? And what basis, what right have you got to tell them that? Where's the evidence? The mini cases themselves, as we mentioned, 10 in certificate year, 10 in diploma year. Prescribed procedures in the certificate year we will ask you, there's 10 defined pre-prescribed topics. For instance, construction of a Lucia jig. Okay, they will, I promise, all have a direct relevance to general practice. They're not esoteric. They're not something that's been dusted down as an old-fashioned procedure. They're all very, very relevant to you guys on a Monday morning. You can go off and use the new skill that you've just been taught. And they're usually based on one of your study days. Okay, it's not a huge amount, 2 or 3 pages maximum, and a few images. For instance, you will learn on one of the perio days the importance and the evidence around not actually touching a patient periodontally, treating them, literally just giving them the information and the power to brush their own teeth and to look after them themselves. So without any intervention, without you actually touching the teeth, you can get them to that. Okay, and it's the evidence behind that, and that is a great mini case. Couple of pictures, and Emily, who's responsible for this one, did a page of write-up. I think she actually did make a reference to delivering better oral health. Okay, but that is a classic mini case. Couple of pictures, page of write-up, and that's it. But it's very, very relevant and very often based on a new technique that you've learned on that study day. The major cases obviously have a lot more to them. We expect 8 in total, so 2 in the certificate year, 4 in the diploma year, and then 2 exam cases. You'll be provided with a template, and it's only marked internally. The exam cases, of course, will be marked externally. The initial case, with the first of the certificate, we're not really concerned. It's certainly less of a case. Those of you who just relatively recently qualified, one of your cases for your final year, it'll probably not even be as complicated as that. It's quite deliberate that we just want you to get into the system of the FGDP CGD way of presenting cases. Okay, so the initial case very often is a molar endo with a crown, plus or minus a bit of perio, or just literally the molar endo and the crown. There will be a huge amount you can discuss. It's not complex case, the treatment, but there's a huge amount you'll be able to discuss right from the endo. What system do you use? What's the evidence base between your irrigation? What's the evidence base between your hand filing or rotary file? Your choice of crown material. What's the evidence base behind that? What's going to allow the prognosis? Your choice of cement. So even though it's a relatively simple case, there's a huge amount that you'd be able to talk about. But the complexity, as I say, we naturally expect it to increase from case 1 through to case 6 in diploma year, and then your 2 exam cases would be the highlight actually, and the sort of the climax of all of your hard work. It's a time to showcase. Okay, if you follow the guidance, certainly from your tutors throughout the other 6 cases, you will not have a problem with the exam cases. And I've just highlighted there, the whole ethos behind ourselves is to take it step by step. So a thorough history and examination leads to a list of provisional diagnoses, special tests, special investigations, then confirm those into a list of definitive diagnoses, which will then you'll be able to develop your treatment options. Then in discussion with your patient and prognoses, you'll develop a treatment plan. And then there's an evidence base around each of those decisions. So whether it's a full mouth rehabilitation or whether it's a simple endo and a crown, you'll still be following that same process. What you're going to get from, well, what I got from, I certainly got an enjoyment, and I'm talking educationally, but also socially. It was great. We really had, and I'm still in contact with a lot of my peers from those days. You will definitely get confidence in your treatment planning. Certainly in the early stages, you're backed up by a very experienced tutor who will always help you, not just on your cases. I get asked quite a lot by my tutees, just advice on something completely nothing to do with the course itself, just on a patient or a potential problem that they're having. You will definitely get the confidence, and you should then develop a love for more advanced restorative work. You will develop, I promise you, you will develop a very, very sound evidence base in restorative dentistry that's modern and way above your peers. And as we keep saying, you will be 2/3 of the way onto your an MSc. We would really like most, if not all, of our diploma graduates to continue to the MSc, because I think you've done the hard work. Why not have the cherry on top of the cake? You've baked the cake, you've worked hard to get that cake, stick the cherry on top. And this bullet point list of common changes, this is certainly what I found. My management of more complex cases is massive now, massive. I'm the go-to person in my surgery, in my practice, and also locally. You will become the person where you, even if just for advice. NHS, where you enhanced practitioner status, you will be able to comfortably complete work that is aimed at tier 2. That then, for instance, for me, has allowed me to build a referral base to that tier 2 level. Obviously not tier 3, not the specialist level, but certainly enhanced skills. Private provision will go through the roof, and it's entirely up to you how you utilize the new skills you've got, whether you continue on the NHS or whether you decide to use them privately. That's up to you. But your ability to increase your private provision will massively increase. Hospitals love people like our successful candidates. I know, for instance, on my own personal, I got 2 hospital jobs based on the fact that I had this FGDP, or as is now the CGD diploma in restorative dentistry. And for myself, I increased my foundation and educational provision. People have asked me to lecture, etc., purely on the basis of my restorative knowledge, which I gained from this course. You will have access to your tutors throughout, Nick and myself and Mike. We will be giving you lectures and online content. We have an online platform with VLE. The lectures are recorded. You'll be given really in-depth, precise, constructive feedback on your assignments. Yes, you have to pass them, but they're not a hurdle. You guys will always regard them as a hurdle, but we always regard them as a learning tool. The amount that you will learn from researching and then writing your assignments is, I won't say is more, but it certainly is up there with the amount that you will learn on your study days. It's such a powerful way of learning. You'll get a lot of handouts, you'll get a lot of module documents. We are here emailing for emails, any communication. You'll get a lot of support. Everything tends to be recorded on the VLE, so you'll be able to research and revisit that when you wish. And you also have your own society of friends. You'll have that peer-assisted learning, which again is a very, very common and very powerful educational tool now, where you will talk to your own peers and you will learn from your peers and you will educate your peers. It's a real two-way process. This is the final slide, guys. For me, we were hit with COVID. Fortunately, we'd already made the decision to revamp the course into a certificate year and a diploma year. And the fact that we'd done it as a certificate year, actually, our delivery of the whole program wasn't hit as badly with COVID as it may have otherwise. We could deliver, because we'd already decided to really give a didactic year, so a lecture-based year, a delivery of knowledge year. We were capable and able to do that remotely. There was only the one unit which we've just had, which was a hands-on, and we've just delivered that at the Eastern. The diploma year has to be delivered hands-on and face-to-face. So we've managed to do that all. We've had a lot of catch-up for the diploma year, because obviously when we had lockdown, we couldn't meet. And instead of finishing in June, the present diploma guys will be continuing until August, but they will be completed in what has been the most challenging of times. We will aim to get face-to-face delivery for the majority of the certificate year, it's over 70%. Even if it's a didactic lecture, we all believe, and there's strong evidence for this, that face-to-face you will learn better. You've also got that softer element of you're meeting your colleagues, you're meeting your peers. The Fridays and Saturdays are almost always in London, typically at Londec, which is part of King's, but we've also used Eastman and ETC venues throughout London. Hopefully we will be keeping remote delivery as low as possible, but it is there as a potential if we need to, depending on COVID and what Mr. Johnson tells us we can or can't do. So guys, I'm going to hand over to Nick now, who's going to take you through some more specifics. I don't see the screen. Anybody any questions up there at the moment? No. Okay. So I'll hand you over to Nick now, guys, and we'll speak at the end.
Phil, would you be happy just to carry on with those same slides for me?
Sure thing, of course.
And I'll just say slide forward and we'll just drop back. If you could go back just a slide or two, Phil, just to that COVID slide and just move on from there. Perfect. If you just and move on one now, that would be lovely. Thanks, guys. So Phil, thanks very much. So hopefully that gives you a fairly decent idea of the course, guys. Just to reiterate a couple of things that Phil touched on. I think it's probably helpful to say that compared to lots of other courses, this is obviously a more academically robust course and always has been. We don't aim to be a CPD course where you just come and go. The aim of this is really to have at the end of this an evidence-based reflective practitioner that's also validated with a postgraduate award with respect to the certificate and the diploma, but also with regard to the MSc. And Phil said it, I would say the same, in that lots of guys sign up to this course as a certificate or maybe a diploma course, but actually what they're thinking of in the longer term, they don't realise it, is they're joining an MSc course. And that's why all of our teaching and training has to be at that level 7 arena for that very reason. All of the tutors and all of the speakers have to be at least level 7 qualified, so everyone must have a master's degree or above, which again to us is really important to make sure that you're being judged and assessed by those that have done a similar process themselves. So I think that's really important. Phil talked about the tutor groups, and with a few cases that we're going to look at now, I've just put some cases in from some recent diplomats, so you can get an idea of the type of dentistry that they're doing. But the tutor groups for me are probably the most precious part of the course. And that really you're having a restorative mentor over that 1 or 2 years that you can bounce cases off in a small group environment. It's not adversarial. It's basically 5 guys, 5 colleagues sitting around having a chat, and you bounce cases off each other. You learn from your other colleagues' cases as well as your own. And in an ideal world, you've then got an experienced mentor that's guiding and teaching and kind of giving you specific advice as to how you manage the cases as you go through. And I think that, for me, having been involved for quite a long time, is the most precious part of the course. You've essentially got a hands-on mentor who can teach and guide and give you advice as you go through. So you can see just some of the cases that we'd expect them to do. So depending on the different years, obviously the bulk of that first year is to get some of the academic teaching and training out of the way. The diploma year really focuses on that hands-on training. So the slide that you see there, it shows fixed removable cases. So partial dentures don't seem to, not the most sexy thing, but something that's probably not done brilliantly. But we want to make sure you start to integrate fixed and removable prosthodontics. So milled crowns, things like that, just taking it to a different level, precision attachments, that more advanced prosthodontics that would probably be more difficult to get elsewhere. Phil, could you possibly just move the slide on one? Thank you. So you can see there the type of cases that we present. This is an exam case, and we can see a well-made, well thought out lower chrome, nice PFM crown on that lower left premolar, integrated around a gold crown as well. So that's the type of kind of high quality prosthodontic work we'd expect the grads to be turning out for exam cases. Nice documentation, nice imaging, so you can start to build things like portfolios up for your own practices, but also undertaking that more complex work. And another slide, Phil, please. Thanks. So aesthetic cases, these would be a really common learning case. So the other aspect of the diploma year, so in the direct restorative placement, we've actually got one of the guys in industry that was on the very first diploma program, and he's now quite a well-known speaker about aesthetics and composites, and he does a 2-day composite course talking about smile design, bleaching, integrating bleaching and composites, as you can see in a case such as this. And then he also talk about composite build-ups with incremental designs, layering up for things like dial approaches and things like that, as well as posterior composite work and sectional matrices, and just really trying to take composite work up to the next level. That could be as good as it can be, but maintaining that conservative ethos that we feel is so important as a philosophy within the course. Phil, another slide, please. From a perio point of view, lots of our guys would be quite into doing kind of these longer perio cases, and ones that perhaps at the minute you might be less confident about managing. So certainly we'd expect guys in diplomat year to be starting to manage those more middle grade advanced perio cases. So in old time money, we'd think about those aggressive cases with or without antibiotics. And a lot of practitioners don't feel happy to do that, so they refer them on and get specialist care immediately. But we would certainly expect that some of our diploma grads are able to diagnose and manage those cases appropriately, know which ones to refer, but also know which ones that they can manage predictably with antibiotics and some of those other advanced techniques that will allow them to do that. Another big periodontal theme that comes out from the course with the diploma days is crown lengthening, a really useful surgical technique, something that lots of guys aren't familiar with or aren't aware of doing. And the diploma days in perio with Ian Dunn will certainly teach you how to crown lengthen, both in the aesthetic zone as well as on posterior teeth, to kind of give you a bit more tooth to get hold of. It really turns unrestorable teeth into restorable teeth in a more predictable way. And that's a 2-day course with pig's heads based at Lundeck, as Phil said. So it gives you an idea, hopefully, the more advanced work that we'll be looking to teach during the course. And another slide, please, Phil. And again, you can see a case like this. This is a fairly well-managed aesthetic case. We can see an element of hypodontia, diminutive upper lateral. And slide, please, Phil. And this was managed with some extractions, some adhesive bridges. So you can see some localized composite work, understanding what we can do with adhesive bridges to optimize the results. And we can see a nice aesthetic result there. And slide again, please, Phil, in terms of what we've got from the start on the upper left to the lower. So we are still using contemporary dental concepts, but hopefully ensuring that the work that's delivered is of the best possible standard and encouraging that best practice ethos that certainly the FGDP has stood for so long, and will move now into CGD, but also to make sure that you can get the best results out of these treatment modalities that you can in your own patients. And slide again, please, Phil. Really common kind of concept at the minute is kind of the smile design with composites. The world has changed in the last 10 years from going from quite aggressive tooth preparations around worn teeth to we've had a little bit of a line bleach and bond, and there's obviously a lot more in the smile designs and composite work that guys are doing now. And these are the type of wear cases where, yep, we want to optimize those patients' aesthetics, but you need to be able to manage them occlusally. So we would expect at the end of the course in the diploma year, having got all the tools occlusally as well as with the composite work, to be able to deliver very effective management of these more advanced wear cases, and ones that you'd be less happy doing now, but would be able to do, I would hope, not only treatment planning with confidence, but actually undertaking with confidence at the end of the course. So to give you an example of some of those wear cases that guys have treated, and slide again, please, Phil. You can see these type of composite dial anterior cases, so conservative, good, appropriate use of composite, managing the occlusion and improving the aesthetics. And slide again, please, Phil. So a case like this, localized anterior wear, we can see it's compensated, no intraocclusal space. Issues with the aesthetics and inverse smile line, but we've also got a lot of enamel, so we want to avoid cutting much more of those teeth. So slide again, please, Phil. And so this was a simple case, simple diagnostics we expect you to do and to be able to document as part of your cases, and then to complete the composite work. And slide again, please, Phil. We're using the index, so we've got our diagnostic. You can do a mock try. And these are nice learning cases to do, to evidence and document what you're able to do diagnostically, but also what you're then able to deliver and transfer into the patient. Slide again, please, Phil. So again, we can see in that case, fairly simple dentistry, managing the occlusion, opening up the vertical dimension with confidence and with the knowledge that it's going to work, and then obviously optimizing the aesthetics with that, with fairly simple treatment, but simple treatment managed and undertaken well. And then slide again, please, Phil. Some of those in terms of more widespread cases. So you can see a slightly wider case here, more advanced tooth wear rather than being localized. It's a more advanced case. And again, these certainly had one of these presented in the exam a couple of weeks ago. And so again, slightly more advanced diagnostics in terms of wax ups. And you can proceed again, slide, please, Phil, just to show what we're doing. So we're building up the anteriors, opening up the vertical, and then slide again, please, Phil. before finishing it off. So this patient had a couple of gold onlays on the posteriors, but you can see essentially this has become a composite recon. And so again, at the end of the course, we'd expect the treatment planning and the delivery of this type of treatment to be something that you can consistently deliver and undertake on your own patients in your own practice with confidence. And that would be Phil and I's and the other tutors' aim. It's always a strange thing at the start of the course. The tutor groups spend a lot of time on cases like this, talking about the process, the sequence, how you would do it. And so you've got almost a plan of treatment as opposed to a treatment plan. But at the end of the course, the tutorials become much easier because most of the guys are actually dictating what's going on, how they're going to manage it, because they've done so many of those cases at that stage. So hopefully it shows that we've got good quality dentistry done well, but even in a more advanced way. And the slide again, please, Phil. So that just gives you a bit of a flavour of some of the cases that can be delivered. I think just to reiterate what Phil talked about with regard to the MSc, we all appreciate that with lots of different courses, there are different amounts of assessment. And obviously it looks, when you look at our course, that we do assess you quite heavily. And we've had to do that because we've got so many relationships with universities that are happy to accredit the course. So from King's Peninsula, University of Kent, lots of our grads go on to do their 1-year articulated top-up after the diploma to get the MSc, which, as Phil showed in one of his last slides, the doors that opens with regard to further teaching, training, lecturing, kind of having that high level degree for hospital appointments. And we feel that makes a big difference in terms of your own career progression. And I think what we will also see with the College of General Dentistry, that may also play much better into their own career progression as that follows through as well. So I hope that's a helpful kind of guide as to the course. We'd obviously be happy to take any questions if anyone had any, or anything else about the course. And obviously, if either of you have got issues or questions that you want to discuss with Phil and I separately, I'm sure we can arrange a chat or a phone call if you've got things that you'd like to discuss with us individually. But if anyone has any questions, more than happy to take any now.
Stunned into silence.
No questions, guys? Everyone seems remaining on mute and not typing. So, well, just to reiterate, if anyone has things they would like to discuss with Phil or I, you can always just let us know, let Barbara know. I'm more than happy to speak on the phone. Sometimes it's helpful to discuss concerns that any of you might have, maybe about your own individual practice or about what you might get out of the course. And both of us are very happy to do that if you want a bit more one-to-one discussion from that point of view. But I think otherwise, I hope that it was helpful and enjoyable for you all and gives you an idea of what the course is about. And we'll let you go and get ready for your Friday evening if you're watching the football or if you're doing anything else. So thanks for joining, guys, and have a good weekend.
Yep. Thanks, guys. And as Nick said, please don't hesitate, contact us. We're more than happy to talk to you.